Okay, so in this first episode, we're going to be talking about COVID-19 and looking at the effects of post-COVID-19, especially on the mental health side of things. Today, we're joined by Peter Higgs, and he's just going to give us a background, and after that, we'll have a bit of a chat. Peter, Can you tell us about yourself?
Oh, wow. Thanks, Rohit. Yep, sure. So, I teach out at Trobe University. I teach in the Department of Public Health there. I've been an academic there for the last 4 years. I actually did social work as my original degree back in the mid-80s. And then I went on to do some work with the Vietnamese community in the inner west of Melbourne, and spent quite a bit of time back and forth to Vietnam in the late 90s, early 2000s, and did a Master's of International Studies. Then I started working at a medical research institute who've been really at the front line, actually, of all this COVID thing called the Burnett Institute. And I did work with them, and I'm still there one day a week working as a researcher with that organisation, mostly working with people who inject drugs, and again focused on the more vulnerable kind of communities, I guess, that we're going to be focused on here in terms of the response to COVID.
Mm-hmm.
And that's kind of where I am. So that's kind of a short history, but yeah, essentially today we're locked out of campus, teaching online and trying to inspire the new generation of public health workers.
Exactly. That's great. Thank you for that. And so, like I was saying today, we wanted to look at the effects of COVID-19, and obviously you've got a world of experience, especially working with vulnerable people. And I think that's one area that's going to be impacted quite heavily, especially going post-COVID and right about now. So what are some of your thoughts?
Yeah, I mean, I think we're really in kind of new territory. I don't think people will have heard the terms public health or epidemiologist or the sorts of things that I'm used to hearing on a daily basis so much in the mainstream media. And that, for us, I guess it's kind of exciting that people are becoming a bit more aware of what it is that the importance of public health.
Yep.
But in terms of the response and what happens beyond the response, I noticed yesterday, so Monday, the 8th of June, New Zealand's basically announced it's COVID-free. So they've managed to eliminate the virus, which is very exciting for them. And also, I guess, as a thing to aim for us as well, we're really down on numbers. If you went back and had a look at the early days in February and March, what the predictions were for where we'd be in the middle of June, I think it's kind of looking a bit like the UK does or the US does, which is very hard for us to imagine. I think that there are 40,000 people who've died in the UK now. They don't do anywhere near the amount of testing that we do. So it's really, we don't know exactly how it is responding to those communities. And I think for us, it's going to be important to think about how we respond going forward and what the society kind of looks like. It certainly won't be what we're used to in a whole lot of ways. We'll be a lot more aware of the way in which viruses impact on our daily lives.
Definitely. Speaking of how we respond, are there anything that you've seen in your experience so far on how we're responding within those vulnerable communities that is, changing?
Yeah, well, again, I've been doing a lot of reading around the way in which we've responded to homeless people, and the fact that governments across the country, here in Australia anyway, have managed to house a whole lot of people that normally wouldn't have been housed. Like they've found accommodation for them, they've found money that will fund them. Going forward, I think it will be tricky to work out, because it's obviously been a response to COVID because they were worried about COVID getting into those communities. And it shows that, I guess, governments have managed to care about that community. They weren't wanting those really vulnerable people being exposed and really dying, I guess. And that's what has happened in lots of parts of the world. But yeah, what we do going forward in terms of, in 6 months' time, towards the end of the year, are we actually going to have sustainable housing options for people from those communities? How are they going to have managed having some structure in their lives that they weren't necessarily used to? And, you know, we've been talking about homelessness my first job was in homelessness in the kind of the 1980s. And, you know yourself living on public housing estates that there are really vulnerable communities who live in and around those communities. They've got chronic mental health problems, some of them. They've got chronic poverty issues. There's a whole lot of social issues that are tied up in that, and just providing a house isn't necessarily enough.
No.
But it's certainly a great first step, and we'll be fascinated to see what happens to that response going forward as well.
Yeah, definitely. Looking at social issues, I want to explore that a little bit more. Has that sort of amplified some of the issues that already existed in our communities?
I mean, yes and no. I mean, I think I've been talking to people who inject drugs for the last 20 years, and we've been doing some specific work about how COVID has affected them, really focused on, has it interrupted supply to their drugs, for example. There's no planes coming into Australia, so how are drugs coming into Australia anymore? Has that really impacted on people's ability to access? And there has been a sense that some of those illicit drugs, and the ones I work with mostly are heroin and methamphetamines, have the price of those has increased, not substantially, but it has increased. People, so that would suggest that there is a bit of a decrease in supply, or else the people who have access to those are taking the opportunity to just increase the price, taking advantage of the fact that most people who are on a fixed income, so are on government support, have had also, so if you're on New Start now, you're getting a double bonus from COVID. So perhaps they're taking a little bit of advantage of that. It's a bit hard to know. People have got a bit more money available to them than they normally wouldn't have. And I guess how services are responding to, social distancing. These are whole concepts that people aren't necessarily familiar with. I've had to work from home. This is the start of my 13th week of working from home. So I've hardly, been out of the house. We're locked off campus. But for a number of those more vulnerable kind of communities, they're just going about their day as is. Trains and buses are still running. There's certainly nowhere near as many people on them. And if you've been on a train into the city, it's just, you see it going past at Kensington. Sometimes it takes me 4 or 5 trains to get on a train if I'm going into the city at peak hour in the morning, because they're so full. But now you can just jump on at any time. How that stuff, I think the reality is for people, they're trying to manage, I guess, their lives as best they kind of can. And there's, not a lot of experience. We don't have a lot of evidence on how we're supposed to respond to these sorts of things. So it's really is very much a wait and see game. And we're relying on, people who work to tell us in the public health kind of space, to tell us what we need to do. So, shutdowns, no attending of football games, restaurants, pubs, now slowly starting to open up. And I think they will do that slowly just because they're scared of what they're calling the second wave of outbreak and how that will respond. And I think we've got a really great example over the weekend where there were all the Black Lives Matters rallies, thousands of people attending that, and not social distancing, basically. There was, quite a lot of people wearing masks. We're still not really sure what the evidence is for the wearing of masks in terms of protecting us, spreading or being exposed. Hand sanitizer obviously is important. There was a lot of that around. But in 2 weeks, I guess we will know whether or not this is something that we need to be really concerned about, or whether or not we can start to loosen up a bit more. If they can say confidently that there was no COVID-19 spread as a result of those mass rallies. Sydney, Melbourne had well over 10,000 people. Maybe that is just the idea we can go forward. I know that Vietnam now has opened its football stadiums. That's one of the first countries in the world to do that. they've had no deaths, but they were very strict on lockdown.
Mm.
And whenever they found a case, they were essentially locking down whole communities until
Wow.
those communities were, it's
Yeah.
like the response phenomenal.
That's, yeah. I mean, it's worked for them.
Yeah,
Yeah.
it has. I mean, but there is a whole lot of things you have to go without.
Exactly.
Like you're having, you know, not really your human rights abused, but you're having
Oh
a
yeah.
whole lot of liberties taken off you that you're giving up.
Hmm.
And we see how some communities are responding in the US to that. They're not really liking it,
No.
and Donald Trump isn't really, he's kind of fueling a lot of that stuff by, not responding in the way in which you would expect as a public health response would be.
Hmm. Um, just touching on public health and the communication that's been going on there, is
Yeah.
there a lot of transparency? Is the information flowing through, or is it just a bit of people just uncertain of what's going on?
No, I think certainly in Victoria, and that's, I guess, where I've been most exposed. We are getting twice a day, we're getting the notification. So we
Okay.
know how many people are being infected twice a day. We know how many of those people are people who come in and are staying in hotels.
Yep.
So returning travellers, and that's certainly 7 out of 10. So 70% of people who've come in
Hmm.
that way, the notifications are coming from that most of the time. There's been some mini outbreaks, as
Yep.
people will be aware of, Cedar Meats and some nursing homes and a couple of McDonald's and
Mm.
those sorts of things. But really, community transmission now, anyway, has
Yep.
seems to have really slowed right down. There
Yes.
were a couple of those early cases where people were coming in from overseas and weren't social isolating or self-isolating, going to parties, some people getting infected that way. So,
Yep.
but that stuff got really picked up very quickly, and we managed to, I guess, pull that all in, and so now it's just dribbling cases as it
Yep.
turns out, and most of those are from people who have returned from overseas themselves.
Mm. Thanks for that. The last question. So going forward, are there anything that we can do to mitigate from a individual sort of
Yeah,
standpoint or like a communal point?
sure. Yeah, and I mean, we touched on this in the pre-briefing around people's own mental health, and I think it
Mm.
is hard for people not to have social contact with friends, family, co-workers when you're used to doing that on a daily basis.
Yep.
And I think, you know, if I was to be really honest and say it's been really tough being an academic who's used to having students around them, like
Yep.
locked off campus for 13 weeks, I just don't have that space. So,
Yeah.
you're doing Zoom meetings regularly. Last week I had 3 2-hour meetings in a row, like you
Yeah.
just, some people are just teaching all day, and it isn't easy to learn this way necessarily. It's not easy to engage in this sort of space.
Hmm.
So going forward, and we're being told we're off campus till the end of the year, so it's
Okay.
not till next year that we're going back. So
Yeah.
it's unlikely, that I'm going to have good contact with students again until next year. So yeah, looking after your own mental health,
Hmm.
doing exercise. People keep talking about, getting out. There's been a massive increase in pets. People, it's impossible to find a dog or a cat at the lost dogs home these days, just
Yeah.
because that sort of stuff, people have taken that upon themselves because they've got something in their lives and they're making the most of that. But yeah, hopefully now that, restaurants are starting to open up,
Hmm.
pubs and bars are being really strict. I went
Yeah.
out for a walk on Friday night, couldn't get into 3 of the places in my local village because I didn't book, and thought you'd
Okay.
just be able to wander in, and they were, they had already their limit in those restaurants or even in the pub,
Yep.
and they weren't letting other people in. But hopefully that stuff will start to move. I know that my daughter's soccer team has started training again in groups of
Hmm.
20. The
Yep.
first week was less than that, but that's been great for her,
Yep.
obviously, and having that opportunity for those women to be able to communicate with other people outside of their own household and
Yeah,
that sort of stuff, and do exercise. I think people, can't underestimate the importance of doing that sort of thing for themselves to take care as well.
definitely. Thank you for that, and thank you for your time and
No
sharing.
worries.
Yeah, coming on board
Excellent.
for our first episode.
See you soon.
So yeah.
Thanks.